This is Barry Bailosis, one of the musculoskeletal radiology fellows at Stanford University. 72-year-old female with chronic low back and hip pain, concern for gluteus medius tendinopathy. On a different patient who presented with left lateral hip pain with concern for gluteus medius tendinopathy, we have this left hip ultrasound. Tendinopathy, similar to other tendons in the body, is demonstrated by abnormal tendon hypoechogenicity and possible increased thickness. Tendon tear, or in this case the partial tear, is defined by hypoechoic or anechoic clefts without complete disruption. On our patient here, we can see a defined hypoechoic cleft just deep to the superficial fibers and posterior to the anterior fibers of the gluteus medius, consistent with partial tearing. Greater trochanteric bursitis is abnormal distension of the subgluteus maximus bursa, which extends laterally between the gluteus medius tendon and the iliotibial tract. Here, on the same patient, we can see abnormal distension of the greater trochanteric bursa just deep to the gluteus maximus here. On a different patient who had MRI hip without contrast, we can see abnormal distension of the greater trochanteric bursa with some hypointense debris here consistent with greater trochanteric bursitis. We can see the anatomic relation to the gluteus maximus, which is superficial to the gluteus greater trochanteric bursa, and just superficial to the gluteus medius tendon. On our coronal PD fat set imaging, we can see again the abnormal greater trochanteric bursa and the gluteus medius tendon just deep to this, and the iliotibial tract laterally. These findings are consistent with greater trochanteric bursitis.